Good afternoon. Welcome to day 242 at the EMA office, where we bring you the latest information on our COVID fight with Chairman Mark Kern and Sam Bierman from the Health Department. And Sam, the numbers are definitely increasing, and so I know you got them.
Today we've said that we were high at 14. I think everyone is going to be shocked at what our county percentage rate is today. Makes 14 look like a good day. So as of today, 127,480 St. Clair County residents have been tested, which is an increase of 1,136 from yesterday. We are at 10,676 positive test results, which is an increase of 212, and that is our largest jump from one day since we started doing this COVID response. And that does include both males and females from under the age of 10 up to their 90s. Today, our daily county positivity rate is 18.7%. We are at 116,804 negative test results and are announcing no new additional deaths today, so we are still at still at 230. For those who have completed the IDPH required 10-day isolation period, we are at 9,114. For state totals, 8,571,019 have been tested, with 511,183 positive test results, which is an increase of 12,623 from yesterday. And for deaths, the state is reporting 10,289, which is an increase of 79 from yesterday. For hospitalization numbers in St. Clair County, currently we have 69 individuals that are admitted due to COVID-related reasons, and 9 of them are on ventilators. Regionally, we have 141 patients that are admitted due to COVID-related reasons, and 18 of them are on ventilators. For our congregate living facilities that are currently or previously in outbreak status, and these numbers are cumulative, we will only announce any facilities that have had changes. Cedarhurst of Shiloh has 18 cases and no deaths, which is an increase of 1 case. Esquilin Dammert Center at the Shrine has 62 cases and 10 deaths, which is an increase of 1 case. And Mercy Rehab and Care Center in Swansea has 24 cases and no deaths, which is an increase of 1 case for that facility. We do have some testing remaining this week, Thursday, November 12th, from 10 a.m. to 12 p.m. and from 1 p.m. to 3 p.m. at Chevy Park in Muscuda. It is at the Ag Building. For more information on those testing sites and any other testing sites that we have, please see both the EMA Facebook page as well as the Health Department Facebook page. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. Really high numbers. You know, the age ranges are totally different from when we started also.
Yes.
So today, 11 are under the age of 10, 25 are teenagers, 39 are in their 20s, 26 are in their 30s, 17 in their 40s, 27 in their 50s, and 24 in their 60s. Above 60s, we only have 19 that have contracted this virus. So it's clear it is in the younger portion of our community.
And when you think about it, those are the kids that maybe are in school and involved in activities, maybe outside of the community, because some areas around here have said we're not doing sports, we're not doing, any activities that have over X amount of people. But we've had several calls to the health department saying, the person that I was exposed to, they were over in St. Louis, or they were, in another state doing these activities, and then they brought it back. So we're seeing, that all of these extra activities might be the culprit.
And most of our older residents know to stay home, know to kind of limit their activities. And I think that's why their numbers are less, because they're really abiding
Taking those precautions
and abiding by the mitigation, so they're not being exposed as people that are out. Some people have to go to work, and so that exposure is going to be there. But man, if you can avoid going out, and you don't have to put yourself in a situation where someone can shed this virus onto you, try to do that. And wearing the mask is a good protection, but the person who has COVID wearing the mask is the best protection. It's to avoid the spread. It's really you saying you're not going to give it to somebody else. You're being considerate by wearing this mask that you're not going to shed the virus to give it to
Exactly.
someone else. So,
Big numbers today. I mean, when we were tallying up our numbers, I texted over to Herb and I said, hang on to your chair because we hit the 200 mark and we've gone past it. I mean, I don't think in the very beginning of this response when we had our first, couple positives, I don't think any of us ever thought that we would see 212 positives in one day.
it took us weeks to get to 212. Now we're there in one day.
Exactly.
So, bad thing. We'll move into the zip code report and show where a lot of those 212 are currently residing. So in 62203, we're now at 314. We go up 8 today. We're up 3 in 62204 to 195. We're up 1 in 62205 to 273. We're up 2 in 62206 to 575. In 62207, we're up 4 to 310. 62208, up 14 to 630. 62220, up 14 to 776. And 62221 goes up 32 today to 994. 62223, up 15 to 677. 62225, up 1 to 50. 62226, up 21 today to 1,150. 62232, up 7 to 286. 62240, up 1 to 56. 62243, up 6 to 194. 62254, up 5 to 337. 62257, up 3 to 72. 62258, up 5 to 318. 62260, up 6 to 234. 62264, up 2 to 125. 62269, up 25 to 922. 62285, up 3 to 204. And 62289, up 1 to 12. Sam said it, we've got 212 new positives in St. Clair County today. We tested 1,136. That brings our daily county positivity to 18.7%. Way back, and it's been a long time since we've been that high. That brings our 7-day rolling average to 12.9%. But don't expect that rolling average to stay that low for long because we've had some bad numbers the last few days, and that's all going to factor into a tough 7-day rolling average. Regional positivity, the state has us pegged at 12.7% today. We continue to go up in regional positivity, and that's because Bond clocks in at 18%, Clinton County at 32.8%, Madison County at 17.9%, Monroe County, again, 27.2%, Randolph County, 8.1% today, St. Clair is at 15.4%, and Washington County is at 20%. All those numbers together in their averaging system puts us at 12.7% regional positivity. All that we're headed to is more mitigations if we don't get these numbers down, and it appears that that it is not looking likely that we're going to be able to get those numbers down anytime soon. Herb?
Well, Region 5 went into mitigation, more mitigation yesterday. So with these numbers, it's expected that we will be following suit. Don't know when. We'll wait for IDPH to give that call to us. On the EMA side, we provided 13 of our first responding agencies with PPE today. As I talked yesterday, we're seeing more of our first responders, our frontline people, being affected with this virus. So I'm hoping that that message got out there, and these 13 agencies called and said we need some more PPE equipment, and we've got it. So we want to make sure we get it out to them because we went up to 12.7. We were 12.4 yesterday regionally. That 7-day rolling, up to 17.9, as you said. It's going to continue to go up. Team St. Clair, as we say each and every day, we appreciate what you do. We got to continue to get this word out there. We're trying to get it out every day. We've even put some commercials on television, trying to keep that word spread out there to the people. I know you are all trying to do that. We're still having a percentage of people say, oh, forget about it, it's still the flu, it's just a cold. But I don't know what it's going to take to make people understand.
And there's no part of St. Clair County that isn't impacted by COVID. Every zip code has significant numbers of COVID positives, and that's true with the entire state. There is no safe place to go. There is no COVID-free zone left in the region, in the country. So don't think that because you're going to go to a rural area that they don't have COVID. Also, COVID is everywhere, and you're just as able to catch it if you're not wearing this mask, and if the person you're with isn't wearing their mask, no matter where you are. So remember that. Just because you're traveling, just because someone has traveled to come see you doesn't mean that they don't have COVID because they're coming from another part of the country or part of the area. Every part is impacted. The chances of having it are significant. We're seeing, because the numbers now are 18.7% positivity.
Well, and we talked about it yesterday that we're getting messages every day from people saying that they've had a family member that's had a mild case of it, and then overnight it's turned into a more severe case. At that time, here the ambulance is called. By that time, we're exposing the paramedics to that. They're going to the emergency room. Those ER doctors and the nurses are being exposed. So it's a domino effect. So we've got to stop that as much as possible, because every time that happens, somebody gets affected, the more people that's going to be affected by it. The possibility of it. We've had the physicians on that have told those horror stories of what takes place even in some of the hospitals. So again, continue to spread the word the best you can. Tell your friends, your neighbors. Take heed of warning, because these numbers are continuing to rise. It takes all of us to get it down. And I'm to the point where I just don't know what else we can tell them. I mean, we've been beating them over the head for 242 days. And a lot of yous are listening, don't get me wrong, but there's still a good percentage out there. We get those calls, we get those messages, the non-believers that it's just a flu, it's going to go away. Well, it was supposed to go away after the election day, and we're still here with it. So for those of you who want to believe that, I can't change your mind, but please, Team St. Clair, continue to spread the word. And hopefully we can get this thing under control real soon and get back to some sense of normal. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and we'll be back tomorrow with day 243 with hopefully some more numbers, but I don't think that's going to happen.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.